And as Missouri continues to see increases in those cases, we're going into day 3 without any statewide health order. Right now, we are joined by Boone Hospital Center Chief Medical Officer, Dr. Robin Blunt. Good morning, Dr. Blunt. Thank you so much for joining us this morning.
Good morning. How are you today?
I'm great. So now earlier this week, your hospital did decide to allow all patients to have at least one visitor each day. What makes your hospital feel comfortable doing so as the state reopens?
Well, we've always strived to relax our visitor policy when we felt comfortable with this and we've always allowed some visitors under certain circumstances, but at this point, we felt that we could continue to keep our guiding principles for keeping our patients, our staff, and our community safe. And we felt that if we could maintain good social distancing, had adequate masks to make sure that everyone in the hospital wore a mask at all times, and had the ability to continue with good hand hygiene, screening those that come in, et cetera, that we could relax those visitor policies and then again allow our patients to have a loved one, which makes a huge difference in how people respond to health care.
Definitely understandable. And now with the state reopening, do area hospitals expect cases to rise in the area?
Well, you know, we know that COVID is not going away. We have really put a lot of measures in place to be sure that a hospital is a safe place to come. And we've also made sure that we have adequate supplies and staff and all of the things we need to provide appropriate and excellent health care. So we are looking at this as basically coexisting with COVID, being able to provide all the health care that people need, as well as take care of any patients with COVID that do present.
That makes sense as well. And then at what point would you say, as we see an increase in cases, would we need to reconsider going back to maybe stricter health orders locally and in the state?
Well, that's something that is monitored daily, really daily by the state, daily by the county. We continue to have regular conversations with other healthcare providers in mid-Missouri, the university, the VA, and the county health department. We have a weekly call. We have a daily dashboard where we all contribute, and we're keeping track of our supplies, blood supplies, PPE, and all of the other things needed to safely provide health care. And, you know, the limiting factor would probably, or at least one of the limiting factors is our ability to provide intensive care to especially the very sick people that might have COVID. So if we start seeing a lot more patients that require ICU care, we would likely have to back off to a certain extent. People that have a COVID and become quite ill and end up on a ventilator often stay on ventilators for an extended period of time. And so we need to make sure we can provide ICU care to the number of people that present with this disease.
And so how is your hospital doing in regard to capacity with COVID-19 patients?
Actually, we are doing very well. We started gradually reopening earlier in early May, and we had a very stepwise approach to that, increasing, starting to reopen at a 50, then 75, then 100% capacity over about a month. And we were very closely monitoring not only the cases in the state and in the area, but also all of our supplies, making sure that we could continue to safely social distance. Everyone in the hospital wears a mask at all times. We have hand hygiene stations, and we are monitoring all of these items, which we've actually been monitoring for well over 3 months, but just making sure that we were safely reopening. So the other item that we did was making sure that we tested every individual who was coming in for a procedure or even needing a procedure while they were in the hospital, and made sure that we obtained that testing before proceeding with anything that would put anyone at risk.
So definitely you guys are clearly taking precautions, but with the state reopening, what would you advise normal people to do that maybe aren't in the hospital within Missouri to continue staying healthy?
Well, honestly, I think we need to continue to realize that COVID is here. It's not going away. I think that's fairly obvious as we do see some increase in cases. And, you know, we need to keep it in our mind. If you are outside and in public areas, if you're going into stores or restaurants, you need to continue to be very aware that social distancing, masking, hand hygiene are all things we should continue to do.
Definitely. And then are you concerned about that increase in cases as well?
Well, honestly, we should always be concerned. We will see more, and it's not just a matter of testing more. It's a matter of more being spread. Until we have a good vaccine, until we have adequate herd immunity, we will be at risk. And so we need to be totally aware that this is here, and that it's still serious, and people that a certain percent of people that do get a case of COVID can be very ill, and some would die. And obviously not everyone who is positive for COVID gets that sick, but the people that do are obviously at risk, or even people that are seemingly healthy can have very serious cases. And we need to do everything we can to protect each other. So we all have an obligation to do the right things to not put other people at risk.
Great information there, Dr. Blunt. Thank you so much for joining us this morning.
You're welcome. Thanks for having me.